My name's Max Feinstein, and I'm an anesthesia resident at the Mount Sinai Hospital in New York City. Imagine being an anesthesia resident and you walk into the preoperative holding area and you see this guy, Dr. Admir Hadzic, world-famous anesthesiologist, and he is your patient. What kind of anesthetic plan would you do for him? What's it like being an anesthesiologist, being on the receiving end of anesthesia? Today I'm actually in Dr. Hadzic's studio in Belgium talking with him about his recent surgery and his anesthesia experience. If you find this video helpful, I'd really appreciate it if you liked it and subscribe to the channel. Let's dive in. Dr. Hadzic, a real pleasure to be here with you in your studio in Belgium. You are a prolific researcher, author, founder of NYSORA, where many anesthesiologists across the world learn about regional anesthesia. Thank you very much for having me.
Pleasure. Welcome to Belgium, Max.
So what happened that you ended up needing to have surgery?
It's just a ski accident that this time did it in. So it is what it is. Rotator cuff repair is what I had. Massive tears, supraspinatus, subscapularis, and biceps tenodesis. So it's just a lot of work.
How did you end up making this diagnosis?
You know, we use ultrasound a lot for musculoskeletal purposes. As you know, we organize courses in regional anesthesia, musculoskeletal medicine and such. And of course, we have ultrasound systems in our offices at NYSORA. So being in pain after the skiing accident, all of a sudden I started developing a complete clinical picture of a rotator cuff tear. I took out my ultrasound system and what I saw was disturbing, and I saw the long head of the biceps tendon dislocated medially, and then that prompted me then to go into further definitive examination by MRI.
So you started the diagnostic pathway by putting an ultrasound probe on yourself and seeing what the pathology was?
Yes, I self-diagnosed.
What sorts of anesthetic management options are there typically for the type of surgery that you needed?
You know, the anesthetic management for this kind of very common condition, rotator cuff tear, there's several different options. You can have a nerve blocks only as a sole anesthetic. You can have a nerve blocks and then a general anesthetic as a main anesthetic, but nerve blocks for postoperative analgesia. And those are two main options. And these options depend, which one you choose, depend really on a number of different things. It depends on you as a patient, whether you want to be awake during the surgery, or do you want to be completely taken out, which would be for general anesthesia. It also depends on a surgeon, because you can't really ask a surgeon to operate under certain kind of anesthesia only if the surgeon does not feel comfortable operating with the patient awake, or if the surgery is going to take longer. The one thing that I would not, as an anesthesiologist, recommend anybody to go on Google or YouTube and ask which anesthesia I should have, and then come to an anesthesiologist and demand that kind of anesthesia that you as a patient read and understand to be the best. Because you can't ask your medical doctor, anesthesiologist, or a surgeon to do something that they're not comfortable doing.
I actually made a video where I was asking ChatGPT questions as if I were a patient wanting to know information from an anesthesiologist, and suffice it to say I was very concerned about the answers that I was receiving. I would not want my patients to be using ChatGPT to get a sense for what they could expect from me, because it was not accurate.
As a patient, you should think about your doctors as mechanics. If you're going to a mechanic to fix, let's say, a problem with let's say heating or overheating a car or exhaust systems, the chances are likely that most mechanics will be able actually to fix this, your brakes and such. But if you go to a mechanic and ask them to fix, I don't know, electrical system, most mechanics do not specialize in that. And while they can fix many of those problems, they're not ideal to ask to fix that because they can cause more problem. It's the same thing. Anesthesiology is a huge discipline, and anesthesiologists subspecialize in different parts of anesthesiology as a discipline. And therefore, you can't really read about something and then go to your anesthesiologist and demand from them that they execute or give you a type of anesthesia in which they do know how to go about, but in which they do not specialize in. So your best bet as a patient is to come in with a condition and ask an anesthesiologist, what is the best kind of anesthesia that you could give me for this? You can tell them your general preferences, but you should never force a medical professional into doing something they do not specialize in.
So to extend the metaphor a little bit, imagine a mechanic has a car that breaks down and they're busy, or I don't know, they have a rotator cuff tear, and so they take their car to another mechanic.
Okay.
And I wonder, in your situation, what sort of input, if any, did you have into what your anesthetic plan was going to be?
Now, I clearly know all the options that I had. There's a number of different kinds of anesthetics I can have, and cocktails of medications, and postoperative and preoperative care. But generally, you do not really want to stray away what that specific clinic does every day. In other words, you do not want to be a VIP who requests a special treatment that is outside of a routine or the algorithm that they use every day, because then you would be really exposing yourself to a potential danger of experiencing substandard anesthetic or substandard care. And likewise, you will be stressing out your doctors by asking them to perform the procedures or type of anesthetic in which they do not necessarily specialize. Now, most anesthesiologists, just about every anesthesia professional, will be able to execute whatever you want them to. But just like mechanics who specialize in brakes, they are much more likely to fix your brakes efficiently as opposed to mechanics who specialize in exhaust systems. So you always have to be very tactful about it.
For viewers of my channel who are anesthesiology trainees or anesthesiologists, just for our own enlightenment, what anesthetic plan did you ultimately end up having for your rotator cuff repair?
In our clinic, there is a combination of a nerve block for pain postoperatively and during the surgery, so that the administration of the opioids is minimal, and the general anesthetic intraoperatively. They asked me, what do you want us to do for you, Dr. Hadzic? And my answer was, whatever we do for everybody every day. But who do you want your anesthesiologist to be? Well, whoever works on that day, it will be my anesthesiologist. If it's good for patients, it's good for me. And if we have standards that we apply every day, every one of our team members will do the same quality of an anesthetic care.
What about patients who come in for this type of surgery but really have no understanding of what the anesthesia entails?
An anesthesiologist must be able to bond with the patient very quickly. I oftentimes, when I approach patients, I approach them as a human being, not as a doctor. And I even crack a joke. Hey, you have it in your shoulder, I just had it fixed. So you really have a very limited time to create that bond and gain trust of your patients. What we typically see in orthopedic surgery is patients who are afraid of needles, and if you explain them that they need to get some kind of a nerve block or an injection for pain that would help them then cope with the pain postoperatively, even though they might sleep during the operation, sometimes you get a pushback in that patients may not understand the full benefit of what you're offering them to do for them, or they may be so afraid of needles that they actually may decline something that's extremely valuable to them, like it was for me. And in that case, we go into a very brief explanation what the nerve block entails and how that's injecting numbing medicine that makes the part of the body that we are operating or working on numb for a number of hours after the operation. And we may even offer them that we would put them lightly to sleep or sedate them so they do not feel or remember. And we definitely, as anesthesiologists, we have means how to allay that anxiety. But I think there's a lot of work to be done on preparing these patients way ahead of the operation by instructing them or educating them by watching videos like yours on your channel, where you explain what actually anesthesia entails, what they are expected to experience, or what they're going to experience as they go into the operating room, or how they're going to feel as you start administering potent anesthetic. I mean, that kind of education is extremely important and goes a long way of making patients understand what to expect and what the benefits of various anesthetic drugs and options may be. Of course, anesthesiology is a huge, a very complicated area, but explained in a lay people's terms so that they understand enough to be able to make informative decisions of benefit to them is something that really is worthwhile investing into. And that's why I commend you on your channel.
I appreciate that. And I really appreciate your time and the opportunity to be here. It's great to talk to you.
Pleasure. Thank you for loaning us your time and giving us a couple of great talks at Nesora.
And also, how important is it to smash that like button? If you enjoyed this video, be sure to check out this video where Dr. Hadzic talks about what it's like to be a VIP, or very important patient, or check out this video where I did a live talk here in Belgium. Thanks very much for watching. See you next time.